Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, a Changing America. I'm Anthony Morneau. Today we discuss mental health on the program. Joining us is Liz Liano, who serves as president of the board of the Southern New Mexico affiliate of the National Alliance of Mental Illness, also known as NAMI. Liz, thank you so much for joining us.
Yeah, absolutely.
I'd like to start off learning a little bit more about your organization. Can you share with us what is the mission of NAMI?
Yeah, absolutely. So the mission of NAMI, so its full title is the National Alliance on Mental Illness, and we seek to provide community resources for all sorts of people, varying from we have peer support groups, we have family support groups, which means if you have a family member that has a lived experience, you can support them by going into a support group of other people who also have family members with lived experiences. We have peer-to-peer classes, which that means you can learn about your own condition. We also have family-to-family classes, which is the similar thing to the family support group. You can learn about your family members' experiences. We have so many, NAMI National is constantly expanding programming, which we can certainly get into later how our NAMI is planning to expand, but they have a program called Ending the Silence, which we would love to adopt and pick up soon as we can get our members trained for it, which goes into the schools and to the young adults and talks to them about mental health basics and what is suicidality, etc.
Peer-to-peer support, you just mentioned that, and programs that offer that type of support. How important are those to addressing mental health in our community?
Oh, absolutely invaluable. Yeah. I recently attended New Mexico First Behavioral Health Town Hall. And what that was is a behavioral health conference, and one of the leading speakers was talking about how important peer support workers are. And so when you're talking to a peer, you're talking to someone who also has a lived experience. I am someone who lives with bipolar disorder, and I would not want to talk about my niche bipolar experiences with someone who maybe maybe if they have a different mental health condition, they would not understand maybe the highs and lows of mania and depression, et cetera, right? So it's beyond helpful for people to be face to face with someone who can literally say, I know and I understand, and they do know and they understand.
Thank you for sharing that with us. Having somebody who has a shared experience when it comes to mental health, how does that affect you when you're having those discussions?
That's a good question. I definitely, I have a strong support system myself, which is something that I emphasize to everybody that I talk to, no matter what setting, which helps me have a strong boundary from interacting with other people on too personal of a level, where I can understand that what's happening with you is what's happening with you, and I can understand it from my informational experience. And it's basically just, being a peer myself, I can say that, So one of the prerequisites for being a peer support worker, which I am, is that you have to have at least 3 to 4 years of recovery under your belt, either from substance use or for your mental health condition. So that recovery is what that barrier is. So I can understand, but I've also worked through it and I've also healed it. So I can say, hey, I get what you're going through, I get that mania, I get that depression, but I've also worked through it, so that's how I can help you work through it.
I appreciate you sharing that with us. I want to learn a little bit more about why you personally wanted to get involved with this. I mean, you shared a little bit about yourself, but it'd be interesting to know, why did you want to dedicate your time to supporting NAMI and then get involved with its mission?
Yeah, thanks for that question. I've been enthralled with mental health issues since probably 13 or 14. I've been dealing with my own bipolar disorder since about 13. That's when I first had my first big depressive episode. And I first started researching it around that time, trying to figure out what's going on with me, and then having loved ones around me who have similar conditions, and trying to figure out what's going on with them, what's happening, like why are we behaving differently? And I first heard of NAMI when I was in college, and I wanted to get a NAMI on campus started, and I ended up just joining the Counseling Undergrad Society, which was and is a wonderful organization for the people who are in it. But I still was like pretty fascinated by NAMI and ended up becoming a member myself. I appreciate that they aim to help the community in the ways that they do, funded by the community. I appreciate like all of the dedication that comes from national. I appreciate that on our board there has to be at least 80% of people on our board have to have lived experiences, which means that either they or a family member is dealing with a mental health condition. So, we're committed to knowing what's happening inside and out. And we outreach to the community. Our organization deals with the LEAD program, which is a law enforcement assisted diversion program. And that's something I'm also very passionate about, is like helping people divert from prisons and jails into rehabilitation, because there's just so many people who don't deserve to be put somewhere that is only going to regress them.
There's been a challenge in New Mexico about having enough facilities and care to address mental health issues for people who may be dealing with these issues in our state. Obviously, funding has been a concern as well with this issue. Now, the program you talked about just now, I'd like to hear a little bit more about that, because there has been a lot of criticism that our jails and our detention centers have become mental health facilities for many folks. It may be the only option that they can have to get timely care if they need it, or perhaps off substance abuse. So I'd like to hear your thoughts on that issue when you hear statements like that.
Yeah, it's important, I think, to have anything at all that diverts people from going directly into the prisons and jails. I think they're like the precursor for anything is education, and people need to first understand that these people are not evil or bad. People who have mental health conditions, or people who are acting out, or people who are on the street and they're addicted to methamphetamines or opiates, they're not bad people. They're sick, and they need a resolution. And we are part of that resolution, the Law Enforcement Assisted Diversion Act. So our peer navigators, they stand in court with folks every Wednesday. And they stand at their aid and basically make the same plea that they are also human, and that they would be much better off being somewhere that would allow for their own progress and rehabilitation rather than regression. There was a story here about a man that was in the news, floated around quite a bit recently. I think his name was David, but he was arrested about 29 times. And that's just a result from people, not understanding how critical it is to get these people a resolution, get these people rehabilitation, rather than just cuffing them, putting them back on the streets, and just kind of waiting to see what might happen.
So how important is it to work with law enforcement, though, to help them recognize this issue and provide the education that they need to know when these instances happen?
Yeah, super important. We definitely try to have our best ties with the law enforcement, and we're getting closer with them. And we definitely like to think that, you know, though NAMI doesn't have any political views, police officers are also people, and they are also people that we like to partner with because they have such power and such a strong place in our community, and they do so much good.
Now, you work to implement community events that help bring awareness to mental health and the issues that surround it in our community, to bring that awareness to our community. Can you share with us some of the things that you've been working on to spread awareness of mental health issues in our community?
Yeah, absolutely. So I have been integrating like my personal art life with NAMI and my mental health life slowly. I've been a performer for the past 4 years, and for the past year, in December actually, we had a really wonderful end of year collaboration NAMI show / poetry show, and we were able to have city councilors Cassandra Gandara, Johanna Bencomo, Gil Sorg, Carrie Hamblin sent in a video. Very much appreciated, because having such wonderful voices endorse mental health. And Carrie Hamblin's video always rings in my ears, because she talked about being an ally, not necessarily having a mental health condition, but having that kind of strong support really resonated. But yeah, so aside from actual NAMI collaboration shows, I also have a spiel at the beginning of my personal shows where I talk about how important it is to go to therapy, talk to your friends, ask them how they're doing, notice if there's a lot of silence coming from your friend's corner. On Saturday, I had a show out at a gallery, and it was the same day that 988 was passed, and it was very exciting, and it was something to celebrate.
Now, you bring up 988, the new national 3-digit number that folks can call if they're experiencing mental health distress, or substance abuse crisis. This number 988 is a new resource nationally that's going to be available. How do you feel that that number can really make a difference when addressing mental health issues in our community?
Magnificently, really. I think that it's hard for people to admit that they need help. I think it's hard for them to pick up the phone and get help. You know, to be honest, I've been that person on the end and just like waiting for either the crisis line or the suicide hotline, and it's just ringing and ringing and ringing and ringing and ringing, and that's very discouraging. And to have something that's more accessible, I think will help unearth a lot of issues that people might just be having had that barrier of just 5 or 6 more minutes.
Wow. Staying on that topic of the 988 number, Searchlight New Mexico recently reported on some issues that some mental health advocates are voicing about concerns they have with the state of New Mexico, saying that they have concerns about community-based mental health services and crisis response systems not getting enough state funding to meet the 988 callers' needs. What are your thoughts on this?
I think mental health can always use more funding. I think that could be correct. I think that we're going to need a lot of units for sure, and not just units, but earlier I was talking about education and and partnering with the police and stuff. Like there is CIT, right, crisis intervention training, or the crisis intervention team. So having those trainings, having those people, like there are people who like train police officers by talking about their own like trauma so like trauma care. So I think that might be the biggest thing too, is like funding that education. Sure, we need like the material aspects of it, but I don't think we can go wrong with more funding for mental health.
At the end of last year, the New Mexico Department of Health announced that there were 520 New Mexicans who died by suicide in 2020. That was an increase of 5 suicides as compared to the previous year. At that time, New Mexico had the 4th highest adjusted rate for suicides in the nation. These numbers are very concerning. So, I know that there's the rollout of the number. When you hear these statistics, I mean, how does that impact the work you're doing?
It just makes us push harder, for sure. Like I was talking about, like we're working on expanding, we're working on rolling out more programs and stuff like that. This only makes us work more furiously. And you're correct, the statistics have risen. The general statistic for mental health, for how many adults have mental health conditions went from 1 in 5 to 1 in 4 during the pandemic. And that's a lot. That's 20 to 25%. It's
very concerning, and I've certainly talked to folks who are concerned about that, as well as the youth who may be facing mental health issues as well. Some concerns there. But I want to talk with you about some work that you've done recently for New Mexico's Influence magazine. You recently wrote a piece that talked about experiences that some folks have with the stigma of mental health in Hispanic communities. Can you share with us a little bit about why you wanted to dive into that issue?
Absolutely. I'm Hispanic myself. I come from West Side El Paso. And I love my family, I love my culture, I love being Hispanic, and I love that my grandparents all came from Mexico. So when I look and critique my culture, I look at it with love. But there is definitely aspects of like machismo and feminismo. I wrote a term paper on the Mexican diaspora, which not to digress into that.
But there is that history of our ancestors, or those who came before us, who pulled themselves up and by their bootstraps and made these great sacrifices to build their own, I should say, future here in the United States for the next generation, perhaps. So, I mean, I'd be interested in learning, what folks were sharing with you about this. I mean, you addressed the machismo culture. Some folks shared very personal experiences with you. Some wanted to remain anonymous because of that same stigma surrounding it. So share with us a little bit more about what you discovered with this piece.
Yeah, it was wonderful. It was interesting to see how some of them kind of fell in line with each other, but like one friend who named himself in my piece, Scott, he talked about how his mom would say, like, if you're gonna get in a fight, you have to win or you're not coming home. And another person who was named in the article, Nicholas, was saying that he was just so tired of this myth that, the older Mexican man built this house on his own. He's like, he didn't do that. He didn't build a house on his own. He had people there who were helping him. But there's people who are perpetuating this myth of not just independence, not just strength of will of man, but isolation, too, is what's being perpetuated underneath all of that. And then the anonymous people, absolutely. Neither of them, one of them had been to therapy and she felt comfortable doing so. And the other person had not been to therapy, kind of talked about how they didn't feel like it was connected to their Hispanic culture, but for some reason didn't trust government, didn't trust doctors, didn't trust therapists. And one might wonder, right? All of these kind of seeming in line with like this lack of trust of putting yourself out there, which, if we might touch back on the diaspora, we left Mexico, we became America, became very identity confused, trying to figure out who are we? You know, we needed to find a sense of home. And when that sense of home becomes very confusing and we're not really sure who we are, there doesn't really seem to be anything to like quell that. We really couldn't find any reprieve other than to be scared and to lock very tightly in a shell. And when we did that, we locked out all help. You know, I've definitely heard Hispanic people call like therapy, call doctors white. You know, like that's just a white thing to do. That's a white thing to do, you know, that's for white people.
Well, what about just the stigma surrounding being able to afford therapy or access to therapy? I mean, how real is that?
Right, yes, yeah, material barriers, that's very real. Many people that I've talked to, I think some of the people that I interviewed too, talked about how they don't think that, you know, they're on the fence because, you know, maybe they'll be able to afford it, maybe not. But generally they hadn't really looked into it. They haven't really looked into like what their insurance will cover or what it won't. But then there are cases when the insurance doesn't cover it, and then that's a material barrier. And how do we get past that? When our hospitals and stuff like that for physical needs, we seem to find a way to get past that. But with the actual mental health stigma on top of a material barrier, that seems a little impassable.
So when there is that real barrier of not being able to afford therapy or being able to afford getting help at a clinic, what is your organization working to do to address that?
We advocate. So we advocate for people. We help them. We can. We will help make phone calls for them. Basically, like Las Cruces is a wonderful city because it's like kind of small, and I feel like all of the mental health agencies are as pretty well connected as they can be, and we stay very connected with all of them. So me and the people who work at NAMI Southern New Mexico can act quickly to find something that might work best for them, while also, you know, having them come to our peer support group or our family support group.
Now, just having enough facilities has been a challenge for New Mexico. Many of our viewers are familiar with the impact that in 2013, the move by the then Governor Susana Martinez, who froze Medicaid funding to some of these facilities with fraud allegations, how that impacted the industry. How has the industry in mental health care responded since that time? Is it back to where it was pre-2013 numbers where folks can find help?
I would say so. I think that standards have raised and improved. I think that we've been working much harder to look closer at the people that we're hiring and at the fine lines between things. I think that definitely was a impediment on probably also how other people are seeing like the mental health care system. Like, I'm sure some people believed that there was just fraud in our mental health care. But I think it's definitely like back to par.
Okay. Now, one thing I did want to talk with you about was the Crisis Triage Center here in Doña County. It was built a while back, and it's been able to open up in recent years. And so I'd like to hear from you. How do you think it's made a difference so far in the short time that it's been open?
I think it's done quite a bit. I've heard secondhand stories of people who have been helped from it, and it's been really wonderful to hear those. I've had a few conversations with the people who run the place, and I've heard the small ways that they've been transforming their infrastructure. And I think that they are an incredible asset because sometimes people don't want to be admitted to inpatient Not everybody wants to even go to outpatient. So for a temporary thing like the crisis triage, I think that, along with 988, is going to be really remarkable for a mental health upswing in our community.
I only have about a minute left with you, but I'd like to hear from you. You touched on this a little bit earlier. Learning if someone you care about is dealing with mental health challenges may be very hard to understand or recognize. Can you share with us what some of those signs may be to where we should be paying attention to check in on those we care about?
Absolutely. If you haven't heard from them in a while, if they seem to be making a lot of jokes that put themselves down, or that they don't like anything, or things seem kind of worthless or hopeless, if they seem to be withdrawing, if they seem to stop doing things that that they loved. Sometimes if you hear them talk in circles, those might be small signifiers, but know that it is kind of different for a case-to-case basis. I would just say look closely at your friends and your family, and if something seems off, I would just say listen to that feeling.
Okay. Liz Liano is president of the board of the Southern New Mexico affiliate of NAMI. Thank you so much for joining us.
Awesome. Thank you, Anthony.
And we want to thank you for joining us for another episode of Fronteras, a Changing America. I'm Anthony Moreno. We'll see you next time.